Welcome everybody. This is Lessons from the Field, and this is an interview series where we have a diverse array of guests who we interview, and all of whom have a common thread of a passion for pharmacy and pharmaceutical sciences. And today we're featuring Michelle Yu, who is a 2019 graduate of our College of Pharmacy. Michelle is now in a PGY2 pharmacy residency in investigational drugs and research at Johns Hopkins Hospital in Baltimore. And like our other guests, I'll be asking Michelle a series of questions. And with those questions, we'll elucidate insight from her on her career and her experience that may benefit those of you listening, students, alumni, and friends of the College of Pharmacy. So without further ado, let's go ahead and get started. So Dr. Yu, if you could just spend maybe a few minutes and walk us through what it's been like to graduate from UIC and go on to Baltimore and your residency program.
Yeah, sure. So my career in pharmacy was pretty non-traditional, I would say. I actually studied my undergraduate career in biomedical engineering. And at the time, I was very interested in biomaterials and tissue engineering. And back then, a lot of the work that was occurring in that area was actually in academic research settings. And I was not very interested in pursuing a master's degree or a PhD. And so it just so happened that I was also working at as an intern at this small startup biopharmaceutical company. And it was very small, but it was growing, and it was very exciting to be a part of it. And they had offered me a full-time job after graduation, and I took it. And with companies being so small, I ended up having a lot of roles and responsibilities, and many of them were way beyond what you would think a person who has only a bachelor's degree would be able to do or would even be allowed to do. And so it was very common at a startup company to have a lot of highs and lows, and there came a point where the trajectory of this company was not so great. And I realized kind of very quickly that it was pretty difficult to find a similar position to what I was doing without having that master's degree, without having a PhD on paper to kind of support the work that I was already doing. And so at the time, one of my friends had recommended that I check out pharmacy as a career option. And so after some research, I decided to go back to pharmacy school at UIC. And I had always thought that having my pharmacy degree, I would go back into the pharmaceutical industry. But then when I started at UIC and I had started taking more of the clinical pharmacy courses and participating in caring for patients, I realized that I wasn't really ready to give that part of it up yet. And so I would remember being in Dr. Pluta's course, in pharmaceutics course, he had a guest lecture from the investigational drug services at UI Health. It was Mike Pacini, if you know him, and he talked about the work that he did in IDS and what he did to support clinical trials. And that was the first time that I had thought, maybe I don't have to choose between the pharmaceutical industry and caring for patients, and that maybe I could do actually both of them. And that kind of started me on this path towards IDS. And so at UIC, I was able to take a IDS rotation at Northwestern. I ended up working for them part-time as an IDS technician. And then through that, I learned about the residency program in investigational drugs and research at Hopkins. And here we are today. I'm in my second year, and it's going very well.
Wow, that sounds great. Well, I'm glad you mentioned Mike Pacini. He's still, I think he retired and now is back with us a little bit, but he's had so many students that have gone through the investigational drug service at our hospital that have, I think, a light bulb has gone off, and they've also wanted to, or been interested in a career in investigational drugs. So I'm glad to hear that that's how you got started with that. And your experience with the drug company sounds very interesting too, and great background for what you've gone on and done since then. So maybe you could tell us a little bit more about the residency itself. I know it's it was a 2-year program. You did a PGY1 and then the PGY2 in investigational drugs. What kind of unique experiences have you had in your time there? And maybe even you could reflect on, you know, because of the pandemic, which has affected both your PGY1 and the start of your PGY2, how has that changed things, or um, maybe change your perspective on things as you go forward?
Sure. This pandemic has definitely affected both years of my residency, and it's exciting to be a part of it. It's unfortunate, but it's a very unique opportunity for learning. It's definitely helped reinforce my choice to pursue this as a career. Before the pandemic, I had already thought that the work in ideas was pretty fascinating. The work that you're doing is supporting clinical trials, and you're on the cutting edge of clinical research and drug development. In IDS, you encounter many unique pharmacy problems that maybe don't occur in pharmacies elsewhere. Like, for example, we have a lot of studies that are blinded studies, and you have to be very careful about how you communicate to other people regarding those studies, and you can inadvertently reveal the blind. Something as simple as talking about an expiration date. If you say that something has been expired and you can't dispense that to a patient, and if the study team has a list of active and placebos and when they expire, they could use the information that you've revealed about expiration dates and figure out whether they're on active or placebo. So it's, you do have to be very careful about things like that. With investigational studies, every study is set up a little bit differently. And so there's a lot of variation in IDS that you have to consider, and it's not as standardized as other pharmacies. You have to always be evaluating whether the task that the protocol is asking you to do, if that complies with local laws, whether or not it complies with USP 797, 800, and you're always keeping in mind patient safety and medication safety at the forefront of your mind as well. And with the ongoing pandemic and the search for treatments and vaccines, you can kind of imagine that research activity has really ramped up very quickly, both in the magnitude of research and the speed of research. And this also meant that the entire IDS operations had to ramp up just as quickly in order to support those clinical trials. I think, to put it into perspective, typically for a normal study, you may have anywhere between a couple weeks to a couple months to set up a new study from when you receive it to the point where you're enrolling patients in the study. And with this increase in research for COVID, we're talking about opening multiple large-scale studies at the same time in the matter of days. And then to maintain that intensity for the however many months that we've had, it's pretty incredible ramp up of services, of operations here in the IDS. And being in the unique position that I am with this residency, I was able to really witness firsthand how the pharmacists were able to handle all of these new requirements, new studies that were flooding in, and how they've really changed their entire operations in order to accommodate that. And so this included things like starting to work on the weekends, whereas we were not open on the weekends before, and to be able to kind of work alongside some of those IDS pharmacy staff and to kind of contribute to COVID research in my own way. That experience overall has really helped to reinforce my decision to come into this. And it's been a very exciting ride so far.
Wow. Yeah, it sounds exciting, busy. I'm sure you're getting just incredible experience. I mean, these are the times where that experience will just be invaluable. So it's really great that you've been able to be a part of that. I mean, Johns Hopkins is obviously a storied institution, university and hospital, and many firsts have happened there. So it's great that you get to see everything that's going on. I mean, we hear Johns Hopkins on the news in relation to the COVID deaths that they report and everything. But you also came from a top college of pharmacy, so you've been able to get experience from two really great institutions. maybe reflecting back on your time at UIC and the experience that you got here, and how has that prepared you for what you're doing now in your residencies and your experience at Johns Hopkins?
Yeah, there's a lot of experiences at UIC that I could pinpoint and say that it's really contributed to my career. One of the biggest and most obvious one is the people that have been there. And so some of my biggest influences at UIC have been Dr. Paul Pluta, Mr. Al Mancini, Dr. Adam Berja, and Dr. Popovich too. You know, so Dr. Pluta and Mr. Mancini, they were so knowledgeable in terms of the pharmaceutical industry and on the technical side of things in drug formulation and drug development. And those are all the things in the pharmaceutical industry that I was interested in. And so they shared with me different opportunities, different possibilities of what I could be doing in the pharmaceutical industry. And, you know, as a student, you don't really know what all is out there. So having them kind of be able to share those experiences, share what they've been through, has been really helpful and eye-opening in terms of the possibilities that I could have. Dr. Berja did the same thing for me in terms of exposing me to different opportunities that were available in a more clinical setting, clinical pharmacy and inpatient hospital setting. And then Dr. Popovich also had his professional development program, as I'm sure other people before me have mentioned as well. And I was also a part of his cohort, and he just held a lot of different sessions that introduced us to different opportunities. You know, he helped us learn about different stress management and time management techniques and things like that. And I feel like all of those things have really helped me kind of get me through pharmacy school. And when, you know, naturally you have self-doubts and things like that, and having somebody like any of the people that I have mentioned kind of serve as a cheerleader telling you you could do it, you know, really helps encourage you and guide you through some of those times. Some of the other things that are experiences from UIC that I feel really helped me in terms of residency, being prepared for residency, were the externship at UIC, at UI Health, and the mobile pharmacy education program, elective course that I had. The externship, I was working at UI Health in the clean room, making IVs and chemotherapy. It was a huge time commitment. And, you know, sometimes you would hear us kind of grumbling about how stressed we were, how we wish we could be studying for exams and instead of working. And it didn't really hit me until my P4 year, when I had rotations with other P4s from other schools, and they were not as comfortable just walking around the hospital and being in the inpatient setting and communicating with providers, whereas I felt very comfortable because I had worked at UIC for so long. Another thing that also really helped me is the elective course with mobile pharmacy education. And it was a course where P2s and P3s were able to kind of run their own patient education service for the hospital. And so I signed up for the course because I was a little shy talking to patients. And that was my way of trying to get me out of my shell and talk to more patients. And like, boy, did it work. Every Tuesday, I was working up patients and counseling them, writing in notes. And then if we had encountered problems, we would have to make the decision whether to contact the pharmacist, the provider, or the nurse. And I feel like having those interactions kind of really made me comfortable in doing those tasks and activities and reaching out to those providers. And I definitely felt that as a P4 student on rotation, and it definitely helped me in residency as well, just to be able to be comfortable doing some of those things.
Wow, that is awesome. I mean, as a dean, listening to you reflect on not only all these faculty, but also experiences that you had while you were here, and the benefit that you got from those, and how that's helped you move forward in your career is just very rewarding. Thank you. I mean, thank you for mentioning those faculty. I mean, we have a lot of great faculty, and every time I talk to alumni, I hear stories like that about specific people who have, gone out of their way to help individual students. That has really made a difference for their future. And some of the ones you mentioned get mentioned a lot. I mean, Nick Popovich, for example, I probably hear about stories like that from all of the advisors in his advising program and all the benefits that they got. But also the clinical experiences that you mentioned, that's really great advice for our current students because those programs are still in existence, and the ability to get that experience, especially for somebody who pushes themselves like it sounds like you did, really good. So I'm gonna kind of combine the next two questions. I know you touched on some of this stuff already, but you mentioned a number of faculty members who you work closely with and gave you great advice. Maybe you could, first of all, tell us anyone, it doesn't have to be them, but anyone who's given you advice that you really thought was something that you want to pass on to others. And then if there was some kind of a eureka moment, and you mentioned a number of really great experiences you had that I think have really impacted you, but if there's any other kind of eureka moments, either while you were here or in your time since being here, or even before you were at UIC, I mean, those are all fair game.
Sure. I think one of the best pieces of advice somebody has ever given me is a volunteer coordinator at a hospice. And so I used to be a part-time volunteer at a hospice, and we had to go through some pretty intense training in order to be a volunteer at a hospice. And during the training, the volunteer coordinator was telling us about caregiver fatigue. And she has said, all you can do is give your best, and your best today may only be 80% of your best yesterday, and that's okay. And I think at the time, that was something that really resonated with me and helped me kind of reframe how I thought about self-expectations. And, there were some days where I was extremely productive, just crossing things off the to-do list. And then there were some days where it really took a lot of energy just to get through all the meetings in a day, And so, and to know that that was okay really helped me relieve some of the maybe stress that I've put on myself, And now I've also learned different things that would make me more or less productive in a day too. So you can kind of modify it a little bit more. For me personally, it is getting enough sleep and having enough to eat. And so those are two main top priorities for me when I'm in residency, because those contribute a lot to how I function during the day. And, I know other residents who get very few hours, 3 to 4 hours a night. And if I did that, I would not be a very pleasant person at all. But the point is that from her advice, I was able to know that if I had a day and it was a little bit off, that it was okay, and that I didn't spend a whole lot of time dwelling or thinking about it.
Well, that's great advice. I think a lot of people put too much pressure on themselves, and for somebody to point out that, as long as you're trying your best and doing your best, it'll be okay. I think that really is very helpful. So that was advice someone gave you, and of course, those listening are gonna, we've passed that on to them now. Do you have other advice that you would give to current pharmacy students who might be listening, whether it's professional advice or personal advice, but they are, they could be just starting. We have P1s that just started last week, or they could be in their 4th year applying for residencies or starting to think about residencies like you've done. And what advice would you give to our students who are going through each of the years of the school, pharmacy school, and to help them, I guess, think about and prepare for situations like you got yourself into, which is very positive?
Yeah, I think the one that really comes to mind is to take chances and take risks and don't be afraid to make mistakes. I think throughout my career and education, there have been many times when I have encountered so many opportunities and I still encounter them every day. And there were a lot of doubts as to, whether or not I should take it. Is that a good idea? And you think about things like, do I have time? Do I have enough energy? Do I really care about this? And will I be successful? And I think, there have been some things where even though I have been very intimidated to take on the certain tasks, I did anyway. And sometimes it's surprising when you try, you are surprised by how much you are able to do, even though you didn't think that you could do it in the first place. And so it can sometimes lead to even more opportunities thereafter. And so I would say, don't be afraid to just try things out. And if you make mistakes or if you fail, get back up, pat it off, shake it off, and on to the next thing.
That's great advice. Thank you. I say the same thing because me, like you, I think, I think many of us, question ourselves whether we can do something and maybe are too conservative about moving forward or taking risks. And I think often putting yourself out there has so many more benefits, and you'll be surprised how well you can do and how well things go. So thank you for that. I think our students will get a lot out of that. So let me just ask one last question as we wrap this up. And if there's anything else that you want to say, of course, you can add to that. But, pharmacy, I think you're early in your career and hopefully see a lot of positive aspects of the profession as you move forward, a lot of opportunities open to you. Maybe you could reflect on where you see the profession going and in the near future or longer term, and that your thoughts there then can help inform our students or other recent graduates in terms of how they move forward with their careers.
Sure. I think coming from an institution like UIC and then going to an institution like, the Johns Hopkins Hospital, you encounter a lot of pharmacists who really care about the profession of pharmacy and who work very, very hard to advance what they can do in their scope of practice. And, in school, we have those conversations every day. And when I'm in practice, I kind of see those conversations happening, I see pharmacists that are developing new services and trying to manage those. And I would hope that all of that effort continues and that it would help to grow the profession of pharmacy and kind of make advancements in terms of what we're able to do in the future. Specifically for the investigational drug services and research pharmacy, I believe there's going to be a lot of growth in the next few years, especially with the new investigational drugs and research residency programs like the one I'm in. They're starting to come out. So the combined program here at Hopkins, we went through our ASHP accreditation visit last year, and we were accredited for a full 8 years, which is quite impressive because this is the first residency of its kind in the country. And so that was pretty cool to be accredited for the full 8 years. The next program at Michigan is going up for their accreditation soon. And then there's a new program that is only the PGY2 year that had just started at Yale this year. And so I think as these residency programs continue to grow, I hope that it will lead to more recognition of what work that the IDS pharmacists do and kind of help drive this field of pharmacy forward and help it grow as well.
Well, it's awesome to be at the cutting edge of that movement as investigational drug services, develop these residency programs, and you'll be one of the first graduates of one. So congratulations. Thank you so much for taking time to give our audience your experience and reflections. Make sure to get a lot of sleep and eat well. And Michelle, if you're back in Chicago, I hope you'll stop by and see us maybe when the pandemic is over. And as I mentioned to you earlier, I have a son at Johns Hopkins who's doing a PhD program there. So if you run into him, please tell him to call home. His mom is really worried about him because he never calls. So thanks, Michelle.
Thank you.
Bye-bye.